Iniziamo quindi la prima sessione del convegno e la prima parte è appunto dedicata al contesto scolastico. Come organizzatori abbiamo voluto appunto dedicare una sessione specifica alla scuola, in quanto è sicuramente uno dei setting importanti dove si svolgono tante azioni di promozione della salute. Naturalmente sappiamo, e lo vedete appunto da molti dei poster che sono presenti giù e dalle presentazioni, e voi tutti dal lavoro sul campo che fate, che in Italia ci sono tanti interventi nell'ambito della scuola. E sapete anche appunto che ci sta il sistema di sorveglianza Occhio alla Salute, che proprio ha cercato di unire il mondo della salute con il mondo della scuola. Tuttavia quello che alcune volte si verifica è che questi interventi avvengono un po' a spot nel nostro Paese e non sempre abbiamo dei buoni sistemi che ne valutano l'efficienza e l'efficacia. È importante che invece sempre più come operatori della salute, appunto come diceva Ricciardi, ma tutti quanti, che sempre più come operatori che lavorano nella sanità pubblica ci impegniamo a valutare anche tutto quello che si fa proprio per migliorare le nostre attività. E adesso do la parola al nostro primo relatore. Abbiamo il grande piacere di avere con noi Goof Buijs, che è il coordinatore di un network molto importante che appunto cerca di unire questi due mondi, quello della salute e quello della scuola, il network SCI, delle scuole che promuovono salute appunto, e lui ve ne parlerà ampiamente. Lui lavora presso l'Istituto, the Institute of Health Care Improvement in Olanda. Parlerà in inglese lentamente, gli ho pregato di parlare lentamente, le slide però sono in italiano e quindi mi auguro che tutti quanti possiate seguire. Grazie mille. Buijs.
Can I get my slides, please? Okay. Good afternoon. Goedemiddag in Dutch. My name is Goof Buijs, and I'm very happy and proud to be here. I will speak slowly. English is not my native language. It's not your native language. But we are part of Europe, so this is a show of demonstration of what European perspective is. The title of my presentation is The Evidence Base for School Health Promotion, the European perspective. Next slide. Can I move it? Okay, the green one. Okay, so I have 5 parts and I have 20 minutes, so 4 minutes for each part. I will say you a little bit about what we mean with health promoting schools. Then I will talk about whole school approach. Specifically, I pay attention to the evidence base of health promoting schools, about a manual, that's my 4th part, to make school policy, and the European perspective. First, about the SHE network, Schools for Health in Europe. This network is coordinated by my organization, CBO, and we are a World Health Organization collaborating center for school health promotion. And we have a saying which says, acting for better schools leading to better lives. Agire per una scuola migliore porta ad una vita migliore. It's interesting. Okay. Grazie. It is interesting that in that payoff we do not use the word health. So we look at health in an even broader context of well-being. The network is a membership of 43 countries in the European region, European Union countries and Eastern European and also Central Asian countries. In each country we have a national or regional coordinator, and we also have a research group The network was founded in 1992 by the World Health Organization, by the Council of Europe, and by the European Commission. And our focus is to make health promoting schools an integral part in both the health and education policies in our countries. This is our European region. It is even too big for this slide. There's a lot more towards the east. Even Vladivostok is in our region, and we count 12 time zones. We have a statement that we say that every child and young person in Europe has the right and should have the opportunity to be educated in a health-promoting school. It is good to think about what do we mean with health. Of course, we use the World Health Organization definition, which says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. However, this is a very old and valid definition, but there are also newer ways of describing health, and a recent one was published in 2011 that says that health is an ability to adapt and to self-manage. It's quite more dynamic than the more static WHO definition, and we use, I would say, the more dynamic interpretation of what is health. In the SHE network and also around the world, we believe that, and we know that the whole school approach is the best way to introduce and do health in schools. So we talk about a policy in a school. We talk about including the environment, both the physical environment and the mental and social environment. We do not only look at knowledge, but also at competencies and health skills. We look very much in the schools as part of communities and with the parents. And also for us, the health services in schools are very important to include. Over the years, we have gathered a lot of evidence, and we say that health promoting schools has many advantages. It does not only lead to more healthy students, but it also leads to better learning achievements. We find also that staff that is working, so teachers, have a higher job satisfaction. Schools also provide better care for the students. There's a better atmosphere at the school. Schools can act more efficiently when there is an issue, like, for example, a sudden incident or a student whose parents has died. That happens a lot. And also it creates a better image of the school. Already in 1997, we have had our first health promoting school conference in Greece, and maybe some of you were there. And we have developed there the 10 health promoting school principles, HPS, health promoting schools. And they are still valid, and that's why I mentioned them. And democracy is a very important one, but also equity, empowerment, and action competence. 4, we also look at the school environment, the curriculum. Teacher training is very important when we talk about health promoting schools. Without teachers, we cannot do health promoting schools. We also find it very important to measure our success and to evaluate. Number 8, cooperation between the education and the health sector is very important, also with other sectors. The communities and parents are important, and also sustainability. What we want to do should be sustainable. Last year, we have developed a fact sheet through the SHE network, and it is about the evidence. It is also, I have a few copies with me, so you can take it. You can also find it on our website. And on our website, we also have a background document. Here we have concised all the relevant evidence about the whole school approach. And what we see, and I find it very interesting, is that the management style in a school, the level of responsibility that students have in what's happening in the school, also how the relationships are between the teachers and the students, and how the school links with the community and the parents. All these factors help to create better health protective factors and reduce risk-taking behavior. And this is, I find it a very interesting fact, that it really matters how the school is being managed. And it's much more than teaching health in the classroom. Then we have evidence from the context in which education is moving. We see, for example, equity is a very important term in education sector. Teacher training, the school culture, the participation of students, how health is linked to the core task of the school, the involvement of parents and the staff, health and well-being, all contribute to the health of students in schools. And finally, what health, the evidence is concerned, we have also an incredible amount of specific studies and researches and also reviews on specific health topics. And I have mentioned the mental and emotional health as number one, and I put 3 stars behind that to indicate that the evidence that whole school approaches to mental health have a very strong influence and positive influence on the health of students. But it's also true for substance use, for hygiene, sexual health and relationships, and also healthy eating and physical activity. The whole school approach shows that there is a link with the curriculum and what's happening outside the school, and that in that case the whole school approach is the most effective. So there is a relationship between good health, between educational achievement, and also with school completion. I know that in almost every European country, about 20% of our students do not complete school with a diploma. What happens with these students? I think it is a main concern for each government to really think about it. And I think that health promoting schools offer an extremely interesting strategy to look at these kind of factors. And these are also factors that are interesting for the education sector. This is a picture I took last year in a school in Bishkek, the capital city of Kyrgyzstan, Central Asia. And this is a school that is a health promoting school. Children are dressed in traditional costume and they offer bread and salt to show their hospitality. Fascinating experience. So what does the SHE network do? We share good practice among countries and among our members. We find research very important, so that's our second point, and identify new areas of research. There is still a strong need for more research, and I'm happy that also in your country, and one of the speakers will present some of his work, is doing that. Also, we try to further maintain and expand the SHE network. We provide technical support to our members. We work very strongly on collaboration between education and health sector, and that also happen on the European level. And also, finally, school health services and health promoting schools link is very important. Some of our future main trends for the network is looking at the health divide, which is important. We look at investing in making people healthier and empowering citizens, tackling Europe's major diseases, in creating healthy environments, and also to promote and adapt the health in all policies from the World Health Organization, Health 2020. Recently, a very interesting paper was developed by World Health Organization, which you can find on our website. and I will make sure that you will get the link somehow. The work that we do in this year is we can do this work because we have funding from the European Commission. We support the network with our annual assembly, with all countries meeting. We provide newsletters that you can get a subscription to, and also are active in social media. We cannot avoid using these modern technologies. Then we have a summer school every year. We provide workshops for our members and also organize country visits, for example, to Latvia this year and to the Russian Federation. Also, we do advocacy, and at the moment we are making a fact sheet on effective networking. We are going to develop language versions of the online manual, which I will talk about shortly, and also support research with workshops and a meeting in November for our members of the network. Then we have a new publication, Innovative Practice Book. This book was developed after our last European conference about health modern schools in Odense. And there is also a contribution from Lombardy, from Danilo Sereda and his colleagues, so I recommend you to read that. I got a few copies with me, and you can download the document on our website. Finally, a few words about our online manual. We have developed a very comprehensive step-by-step guide for schools in how to do this, how to become a health promoting school. It is really about implementation. It's a tool, a manual which provides school staff an introduction, what are health promoting schools, and support them in making a plan and a policy. It is developed for schools who want to become a health promoting school, who are already active and want to improve. The manual is a step-by-step guide, as I said, using 5 phases, which is the quality management cycle that you maybe recognize. And for each step, we have given practical examples, questions, and also we have some accompanying documents on our website. We have language versions of this manual by the end of this year in 9 languages, and we hope that next year also Italy will make a translation to facilitate schools in your country to become a health promoting school. A few words I want to say finally about the European perspective. The fact that I'm speaking here is one reason to think about it. I think it can help a lot in your country and in your regions to support the evidence for our work. Also, we can learn a lot from each other. There are so many rich experiences all around, very close to us, that we can really improve from that. And there are a lot of similarities, despite all our cultural differences. Each country has a lot to offer, and also social media do not stay within the country, they cross borders. And I also want to say that this year we have now 2 regions from Italy, Lombardy region and Piemonte, who are member of the SHE network. And we invite the other 19 Italian regions also to join our network. We have made a video, was launched 2 weeks ago, which is an 8-minute video for schools how to become a health promoting school. It is on our website, and we have also a version with Italian subtitles. So that can help you and maybe your schools to get a flavor of what it is to become a health promoting school. Here are my contact details, my email address, and the website of the SHE network, which I hope you will have a look at. I'm sure you will get the presentation with all the details, and thank you very much for your attention.